Health Watch is presented by UMass Memorial Health Care. Here, caring for you.
Welcome to Health Watch, presented by UMass Memorial Health Care. I'm Brittany Schaefer. Today we're here to talk about the new RITA-T Autism test.
RITA-T stands for Rapid Interactive Screening Test for Autism in Toddlers. So this is designed in younger children. It is interactive because it's almost like a small game that we do with a child, but at the same time we're trying to trigger behaviors that could be associated with autism spectrum disorder. It takes 5 to 10 minutes to administer and score, and we have been working on its development for the last 7 years. We are just getting ready to launch the online training for it. It has been very helpful, and we have tested so far close to 500 toddlers. So toddlers, those are children between the ages of 12 months and 3 years of age. And it does help because, let's say, a parent or an early intervention provider or a pediatrician has concerns for autism spectrum disorder, or maybe they have concerns because the child is not talking or not making good eye contact, or maybe there is another child in the family with autism spectrum disorder. So it can help as a screening test to see if we should really be concerned to ask for a full evaluation for autism spectrum disorders. What is being done so far is, let's say, pediatricians and providers can administer what we call a level 1 screening, which is a parent questionnaire. And the one that most families know or have heard about is called the MChat. And it's 23 questions that the pediatrician should give to families at ages 18 months and 24 months, or any other ages if they have concerns. And usually this is a good screening test, but what happens is sometimes it's a questionnaire, so first-time parents who don't know very well English, or parents who maybe the child does things with them but does not do the same behaviors with others. So a lot of the times it could be scored as the child has no issues and this is passed, or it may be scored that the child has really severe issues, and then they are referred for a specialist. So in both cases, so what happens is if it's scored as there are no issues, but the parent still thinks that, oh, you know what, I'm still concerned, then they have to wait longer until there are more concerns that are seen, and then they are sent to a specialist. And the other case where there are so many concerns that came up on the questionnaire, they're going to also be sent to a specialist to have the full evaluation. But what happens too is there are not a lot of specialists for this type of evaluations and for this age, and wait times have been increasing. It's all over the country, so it's not only in Massachusetts. So we have stories of 2 years old waiting for almost a year, which is half their age, to be seen. And sometimes it's not, because as we go back to a level 1, which is the MChat, which is an excellent screening test, but it's not really only specific for autism. So when it's positive in 10 children, not all the 10 are going to have autism spectrum disorder. Half of them will end up. But the 10 should have been picked up because they need more attention for other interventions. But in real life, we get all the 10, and so this is what delays the wait time. So having something like a RITA-T would be in the middle, so between, let's say, a level 1, where you're really picking up a big group, and then the big diagnostic eval that costs a lot of money, that is long, and there is not a lot of people who do it. So having something in the middle like the RITA-T helps then understand who are the kids who really need to be seen fast so that they get the evaluation and they get the services. Everybody else will be seen, but this way we are able to get them through 2 different clinics, and they're not, delaying each other.
Who is the RITA-T designed for?
It is intended to use by any early childhood provider. So it could be pediatrician, it could be a nurse practitioner, it could be an MA in the office, it could be any early childhood provider. So I've trained a spectrum of specialists and providers, from speech therapists, occupational therapists, social workers, psychologists, to developmental pediatrician, to pediatricians. And it's really any early childhood provider can learn how to administer it and how to score it. The training takes 3 hours. It is an interactive test, so we do need to be trained for it to know how to administer each one and how to score it, because it's important to do it well so that you can make sense of the results, or else. And this is where I wanted it to be accessible for anyone who wanted to train on it. So we have been working at UMass for the last year with the IT department to develop a training online that will become accessible and open in April. And so any early childhood provider can train on it.
How are toys a part of the RITA-T screening kit?
We have the magic ball, and the ball disappears and the ball appears. And then for a 2-year-old, this is fun, right? Oh, they see a ball and they don't see it. And then you expect that they show that they're surprised, and you expect that they want to look to their mom or the examiner like, what happened? Where did it go? And this is the typical reaction. Children who are at risk of having an autism spectrum disorder, they may not notice that the ball disappeared, or they may notice but not share it with others. So they may not share with the mother or the provider or the caregiver. And this is one of the items we score. One of the other fun things, and this is why it's all magic tricks, so it's the magic scarf. So it changes colors. But again, for a 2-year-old, 2.5, this is fun, especially when they're starting to learn colors, like what is happening? Why did this change? This and this test more or less the same concept of I'm recognizing something changed that is not supposed to change, and I'm surprised, I have a reaction, but I want to share and look at my mom or my dad and look at the examiner, like what is the examiner doing? So there is a lot of nonverbal communication and awareness that goes through this. So already we get a lot of information. Then we have a phone, and who does not like to have a phone and play with a phone, especially in 18 months or a 2-year-old. And we do some what we call presses meaning we're going to create a situation to try to get a reaction from the child. And so also with the phone, so we have them play with it, and then we try to block it, and then we try to tease them with it and see what they would react. So all of those, over 7 years, we have developed a scoring sheet, and we have developed how to score them, and we have tested this, so to see if it correlates, and at what score level would you say it correlates, and at what score level you don't have concerns. We also ask from the parent to pretend to cry, so we see what the child reacts to it, and to pretend to have a neutral face, so a face without emotion, and then to see what the child would react.
How important is early detection?
The earlier we can catch it, the earlier we can start to treat it, the better the outcome. Right. And this is true for development, and this is true for any developmental delay, whether it's language delay, motor delay, whether it is learning delay. And it's extremely true for autism spectrum disorder, especially true for autism spectrum disorder, because the child needs the specific diagnoses to access specific treatment. Any child with developmental delay, the family can connect with early intervention. Early intervention can start working with them. They don't need a diagnosis. But for autism spectrum disorder, they still need to go through early intervention, but they will need the diagnosis to get the more intensive behavioral treatment, which is called ABA, that will definitely also help to make progress.
What is the difference between the traditional autism screening and the RITA-T test?
This is a new test, and it's interactive, and it's short, and it's easy to train, and it showed very good correlation with later diagnoses of autism spectrum disorder or developmental delay, so it helps to separate. It's not a questionnaire. We're not relying on the parent who is a good historian, but sometimes has difficulty filling questionnaires. And this test basically is all about nonverbal communication, social interaction, the nonverbal cues.
At what point should parents be concerned?
Parents should be concerned at any time if they feel that the child used to do things and now they are not doing them anymore. If they had language and now they lost words, or if they used to point but now they're not pointing as much. At any age, they should go see the pediatrician. And I strongly recommend that don't wait for the next well-child visit. If it's like in 6 months, call the office, say, I am concerned about my child development. I would like to come in and discuss this with my pediatrician.